My area is what we call social and administrative pharmacy, and I also have a focus on public health, and I focus on health disparities. I'm from Nigeria, trained as a pharmacist in Nigeria, and I worked in an HIV clinic in a rural area. When I came to the University of Minnesota, it was so interesting. I wanted to continue with my HIV work. I saw that we had data on African American women and we had data on African-born women. And African-born women actually had higher incident rates. With my community partner, we began to look at what are the drivers. Honestly, it's the community partners that drive the work because community partners are from the community. We started with a needs assessment to be able to bring different stakeholders together, including in the Minnesota Department of Health and other entities, to talk about what HIV looks like in the African immigrant population. We worked with them to adapt a curriculum that was focused on sexual and reproductive health. HIV has such stigma associated with it in many of our African cultures. If you're going to empower women with information, with education, you want to look at what is valuable to them, and reproductive health is very valuable. So it's work where it's geared towards action. It's not work that is supposed to just be in some publication. I mean, we do have publications, but it's work that is intended to result in action. Here in Duluth, I have worked with the African American community. And so when COVID started, what we wanted to do was to understand what's going on, what are the drivers, and then what can be done. So many different stakeholders got involved. The county health department, Health Equity Northland, and just a whole lot of other entities. We initiated another needs assessment. And so the findings began to also drive efforts with vaccine clinics. There was a huge effort around that to actually develop messaging with teens. Another part of that intervention was having Black healthcare providers provide that information. We bring some resources, they have the key resources that are needed, because you can't buy relationship, you can't buy networks, you can buy trust, community engagement, that piece. That is what is really critical.